It's really been about 50 years since there was a new form of cancer therapy. I think the future of oncology is going to be immunotherapy. So we're at the very beginning now of a new era. These CAR T cells work by killing the target cell that we direct them to. So in the case of cancer, we ask the CAR T cells to kill cancer cells specifically. We do this by taking cells out of your body. 1, 2, 3. We reprogram them and inject them back into the patient. The precision of a CAR T cell is exquisite. It will kill whatever we ask it to kill and then leave the rest of the cells in our body alone. And that's very different than chemotherapy, which doesn't discriminate so well. It's called synthetic biology. We can make cells do things that nature didn't allow them to do in the first place. April 11th, 2012. And that's the day we treated Emily Whitehead, our first pediatric patient with CAR T cells. About 5 to 6 days after she was treated, she had a violent reaction. She was in the intensive care unit on a respirator with failing organs. The physicians and the family thought she might die. And that was all due to the immune system killing her leukemia. She had pounds of leukemia at the time. We gave her a medicine called tocilizumab. It had never been used before in a cancer patient. And within hours, she woke up. And it was definitely a remarkable event. I mean, when she woke up, the clouds were clear. And within just over a week, she was in remission.
Tonight, a new frontier in the fight against cancer. For the first time, the FDA approving a genetically engineered immune therapy developed by the University of Pennsylvania.
The FDA approval really gives a mark that we've made something happen, and it happened here in Philadelphia at the university, which is an incredible landmark. Oftentimes people have to die to have that happen. And so I'm really lucky that I'm still around to see this incredible transformation. And now we need to have laser focus to get us to the next level. We've used CAR T cell therapy for blood cancer for more than 10 years, and now we're working on going beyond just blood cancer to literally every cancer you can think of. Pancreatic cancer, ovarian cancer, and brain cancer. All of those are on trials here at the Abramson Cancer Center. Patients with glioblastoma with CAR T cells back in 2015, and we got to first base on that. We were able to give safely the CAR T cells to the patients, but no one benefited. And now with our third trial, which we just reported, 6 patients with glioblastoma treated with CAR T cells developed right here. All 6 patients have had radiographic improvement, meaning on MRIs of their head, the tumor has shrunk. Now we have a glimmer of hope, I think, that
progressing in a way that we really haven't seen with any other form of therapy that we have available for patients now.
A powerful statement, and this is what's behind it. 2 brain scans of a glioblastoma patient's tumor. The one on the right showing the tumor is dramatically smaller after just 1 dose of the new therapy, now in early clinical trials at Mass General Cancer Center.
We collect T cells from the patient's blood, engineer them with this CAR T molecule, and then put them back into the fluid around the brain.
Dr. Marcella Moss and Dr. Brian Choi are leading the team, taking a form of immunotherapy that's used to fight other cancers and adding a new layer to target stubborn glioblastoma brain tumors. CAR T cell therapy uses the body's own T cells to fight a patient's cancer, but using it to fight brain tumors hasn't been successful because the brain is so highly protected. This new therapy uses a team approach, injecting engineered cells into the fluid around the brain where they train other T cells to zero in on the tumor and kill it.
It's been several decades before we've even had a therapy that has moved the needle at all in terms of prolonging the survival of patients with this cancer. So in a way, it's unprecedented.
Tom Frazier is one of 3 patients taking part in this trial. The 72-year-old father and grandfather saw his tumor shrink by more than 60%, and the results of that single low dose of therapy lasted for 6 months. In a statement, Frazier said he felt extremely fortunate to have found this trial when he did, saying it was the most promising cutting-edge treatment available, and we immediately knew this exciting trial could actually help me and possibly many others in the future. For Moss and Choi, the fact that similar efforts are taking place in labs and hospitals around the country means that a breakthrough is on the horizon.
I think we're all learning from each other, and I think it means that there's sort of multiple shots on goal.
This is the real inflection point for our ability to make an impact.
There are individuals who are long-term survivals of glioblastoma. And by survival, I mean 10 years, 20 years. There's only one way that can happen, and that's the body's immune system recognizing the intruder, the cancer cell. So now that we can harness the body's immune system and regulate it to attack these tumor cells, I think we've got a shot.
Is a phase 1 clinical trial in which we're bringing CAR T cells that are genetically modified to target the B7H3 antigen on the surface of glioblastoma brain tumor cells. And we're delivering that therapy to our patients and understanding the mechanism behind which it may work in our patients, and also the safety and feasibility. And what we're seeing is that not only are we achieving the intended effect, but also patients are recovering neurologic functions that they had lost otherwise as a result of their brain tumor diagnosis.
If this trial is effective, it will impact the care of glioblastoma significantly.
As a neuro-oncologist, I'm typically having very difficult conversations in my clinic when I'm delivering this new diagnosis of glioblastoma to our patients. And yet, with this clinical trial, I have had more tears of joy in my clinic encounters with my patients than otherwise. And that gives me a lot of hope. And seeing tumors actually being treated and having the desired effect that we were hoping for and manifest in our patients who are actually improving clinically over time through the course of their therapy is giving me so much hope that we are a part of a new chapter for patients diagnosed with glioblastoma.
Cancer had kicked into high gear. We knew right away, chemo's not going to work. Let's do the trial.
So when we met Karen for the first time, we thought that she would be actually a perfect candidate for it because not only she was herself was eager and she was very interested in the idea of immunotherapy. And
that was a good thing. You know, your body's supposed to fight the cancer to begin with. So when it doesn't, why not re-engineer the cells to kind of tell them what to do? The trial was going to be difficult, and I knew I was admitted to Memorial Sloan Kettering. The cells took about, an hour or so. It was a very small bag, and an hour after I received my cells, I started getting sick. When your body starts reacting to the kill-off, it's called a cytokine storm, and that is when the body is saying, enough. But it's the kill-off of the cancer and the body trying to get rid of it all. The doctors want this storm to continue because the bigger kill-off of the cancer cells, you have, the more likelihood that it will be very successful.
The two most common side effects are high fevers, maybe blood pressure issues, and perhaps some breathing issues, disorientation, confusion. That's what Karen got. Patients after receiving the CAR T cells and in the midst of the cytokine release syndrome, it's kind of not easy for the patient's family members to see that. So my job is really kind of educate them and saying, we've seen this before, you're gonna get better, let's just get through it together. Because it's hard to see what comes, even though I know it's a reversible thing.
He said, we brought you to the edge, brought you as far as we could, and then we had to stop it.
It was a very gradual, but every day she'd be a little better.
And I was in the hospital for 25 nights. 8 of those nights were in ICU. We had a doctor's appointment 1 week later, and he walked in and he said, you're cancer-free. You know, and we never, ever thought we'd hear those words. They were getting ready to do the bone marrow transplant on top of everything. And we kind of talked with Dr. Park and said, why can't this CAR T-cell trial, why can't this be the cure?
You know, Karen was in the hospital for 3 weeks. 3 weeks after that, she was golfing.